If you're currently struggling with a rheumatoid arthritis flare or a flare with a lot of pain, then you gotta keep watching this video because today we're gonna be talking about natural ways that you can use at home to get out of an arthritis flare. Hi, I'm Dr. Micah, board certified rheumatologist and also an arthritis patient. And today we're gonna be talking about ways that we can get better with our arthritis through natural ways. And these are ways that I get better myself if I do have a flare also. As you know, I've been struggling for many years with arthritis and I got better through natural ways, and I believe that you can as well. However, there are times that even though we're feeling really good, that the arthritis can come out and give us attacks. And as a rheumatologist, we tend to give prednisone or steroids to patients to get out of their flares. But is there another solution besides steroids and prednisone? Because even though it may be very useful in the short term, in the long term, if we take it for months and years, it can lead to many detrimental side effects that I've talked about in another video on the side effects of prednisone or steroids. So as a rheumatologist, I tell my patients, if you don't have to take prednisone, then don't take it. There are natural ways to get better with your flare. And today I'm going to talk about 4 different types of natural ways to get out of flare. The first technique to get out of flare is one of my favorites, and it might be the hardest, and that's water fasting. And that means eating nothing at all for a long period of time and only drinking water as needed. So water fasting could be up to a day. Some people do it for 2 days, 3 days. There's even fasting centers in the United States, and I know a couple of them in California, that you can actually live in these places, and there are maybe chiropractors or doctors that actually watch you, make sure your blood sugar doesn't drop too low, or make sure you don't feel terrible. But there are places that you can fast for weeks and even a month. I've seen patients that have come to my own clinic that have gone to these places, and they sometimes do feel better when they're at these fasting places. But when you're at home, I don't recommend fasting that long. For myself, I fasted at most probably 48 hours to get out of my own arthritis flare in the past. And sometimes when I do flare, I do see improvement after 18 to 24 hours of fasting. And sometimes I may fast if I eat a not so healthy meal, if I eat fried food, a lot of seed oils, or something I know that might trigger some pain, or I feel a little twinge and something doesn't feel right with my own arthritis, I will fast for an extended period of time, more than just the 6 or 12 hours or 18 hours, just so that I can feel better. So one of the ways that I like to fast is having my last meal be dinner time and then not eating the next morning or the next lunch or even the next dinner. So that's one of the ways that I can do a 24-hour fast. Now, there are certain patients in the population that probably shouldn't fast, such as patients with type 1 diabetes, because when you fast, you can go into ketosis, and sometimes ketosis isn't very safe in certain patients with certain conditions. So before you consider fasting, you may want to talk to your doctor to see if fasting is even an option with your condition. But I've seen my own patients who have fasted and they've gotten better during the time that they fasted. And when they go to these fasting centers and they fast for maybe a week or 2 weeks or even 3 weeks, sometimes they may feel better at the time of the fast. But after the water fast is done, sometimes they can go back to having pain again. And there are studies out there on arthritis and autoimmune diseases and fasting. Now, I'm going to show you a couple examples here. Psoriatic arthritis, they did a study on patients during Ramadan, and these patients fasted throughout the day. And in these patients with psoriatic arthritis that did fast, they did have an improvement with their pain and inflammation overall over the course of time that they did Ramadan. And also, there was a study back in the 1990s on rheumatoid arthritis, and these patients also fasted. And during the fast, these patients also had an improvement of their disease activity, inflammation, joint pain, and joint swelling as well. So fasting has been studied, and there's many great things with fasting besides just improvement with joint pain. There is an improvement with inflammation. And overall, sometimes patients use fasting as an anti-aging process. So overall, fasting can be very useful, especially in an acute flare. Of course, it's not magic. It's not gonna fix every single patient that's in the flare, but certain patients in the population, if they do fast, they can get better. And for myself, I'm one of those patients who, when I do water fast, I do feel an immediate improvement during that 24-hour water fast. And technique number 2 on the natural way of getting better with an arthritis flare, and that's supplements. Supplements can be very useful in treating a flare. For example, we know turmeric, which I've talked about in this channel already. Curcumin, the active ingredient in turmeric, can be very anti-inflammatory. And I generally take about 2 grams of turmeric. Now, there are a lot of other anti-inflammatory supplements that can be very useful as well, such as boswellia. There have been studies on 1200 milligrams of boswellia. I love boswellia as a supplement. Other supplements include omega-3 oils, which can be fish oil or algae oil for patients that are vegan or vegetarian. Also, cat's claw can be anti-inflammatory. Chinese skullcap can also be anti-inflammatory as well. And so can devil's claw, which can help with pain levels. So taking different anti-inflammatory supplements can be very useful for patients to help with their arthritis and pain flares. And not only are these supplements useful for these arthritis, it can be useful in other autoimmune disease as well, because these supplements are anti-inflammatory. And what do we have with autoimmune disease overall? It's inflammation. So these different supplements can attack the underlying inflammation and help patients overall. So sometimes, at least I do, I combine the fasting with supplements to help with my pain. And not only that, sometimes I take extra doses of my anti-inflammatory supplements just to get better. Now, before you consider taking extra supplements, I highly advise that you talk to your doctor to determine if certain supplements are safe for your condition. And one of my favorite supplements I didn't mention is vitamin D. I do take extra vitamin D myself if I do have a flare. Now, most of the time I don't have flares. I would say a very fortunate and high functioning arthritis patient, because day to day I don't get stiffness, I don't get pain. I do martial arts, I do weight training, I run, I do plyometrics, and I feel great. It's only if I eat a really poor diet for a couple of days, then I might get something coming back, but overall I feel really good. Number 3 on the natural way to get better out of a flare is red light therapy. You might be surprised with red light therapy. I haven't talked about it much on this channel, but red light therapy is also known as photobiomodulation. And photobiomodulation is using red light therapy to get better with your inflammation and joints. You've probably gone to med spas or saunas that have red light therapy shining on you, and there are studies to show that it can help with wrinkles, skin issues, but there is studies on RA and other joint problems like osteoarthritis. And it probably wouldn't help to just have one light, a small light, if you're having overall body pain. However, if you're having one finger or 2 fingers that are painful, it could be useful to shine it directly on that joint that's affected. But if it's a whole body that's affected, then maybe like going to a room like a sauna or something with red light can be useful to helping patients get out of a flare. So there are studies with rheumatoid arthritis and other autoimmune diseases with red light therapy, and that's one of the newer techniques that your rheumatologist or integrative doctor or a regular doctor may not talk about. But red light therapy, also known as photobiomodulation, is one of my favorite techniques, and that's what I tell my patients as well. And there are multiple types. There are types that you can even bring with you to travel with. So I have a red light therapy device that I just put in my suitcase that I travel with when I, like for example, last year I went to Japan, I brought it with me. And if I ate really crappy, because when I travel, even though I try to eat healthy at home, when I travel, I want to experience the culture and the different food. So I do have some junk food over there, and sometimes it does get to me. And so I bring the red light therapy just in case something happens to me. And natural technique number 4 to get out of an arthritis flare or pain flare naturally and quickly is eating green smoothies or lots of vegetables. Now, you know I'm a big fan of eating vegetables, and it's because of the fiber and the phytonutrients. I myself will eat a lot of vegetables and green smoothies, especially when I do feel like something's coming on, like a little attack's coming on. And it does help me. And if you ask me how much green smoothie should I be drinking, well, I actually fill it up to the top of a Vitamix. So you're probably asking me, what goes in a green smoothie? How do I make it at home? Well, making a green smoothie can be quite simple and it's not expensive. So you can put any vegetable you like in a blender. So you can put spinach, spring mix that you use in salads. You can put broccoli, you can put chard, you can put celery, whatever you like. I keep it simple. I put kale, I put some spring mix, and I put like 3 or 4 handfuls in there. And then I add some frozen or fresh fruits, and I fill up water to maybe a quarter of the blender, and I blend it up. And I would just down it. Literally, I would take the blender, put in a big cup, and I'll drink multiple cups at one time. Sometimes I'll drink half of it and save it for the rest of the day because sometimes it's a lot. And that's one quick way to get a lot of vegetables in. And I would eat very, very clean the day if I get a flare or I feel like a flare might be coming on the next couple hours or the next day. Because, you know, as an arthritis patient, you know when you're uncomfortable or there's some pain that's about to come on. And I've been able to avoid flares and pain with this technique of fasting maybe 1 or 2 days in a row, and then not only doing that but adding supplements, doing the red light therapy, and also drinking smoothies or eating a lot of vegetables. So a combination of these different techniques has helped me a lot with my own arthritis flares. So if you're currently struggling and you're in a lot of pain, just know that yes, prednisone and steroids is a quick fix, but if you don't want to take that, there are other potential ways of getting better. And it could be natural as well. So please talk to your doctor before you do any of this stuff. I'm not your doctor, I'm not your rheumatologist. I am an integrated rheumatologist that likes to educate on social media, and I'm an arthritis patient as well. So I like talking about my own experience and how I got better myself and how I get better nowadays if I do experience some pain. I know it's hard to be in a flare, and know that there are better days ahead, that you can get better naturally and quickly. So if you found these tips helpful and they're new to you, then please hit the like button, comment below what you've used in helping yourself get out of a flare. And please hit the subscribe button so that you can continue watching more videos of me explaining new concepts in integrative rheumatology, but also how I deal with arthritis myself as a patient. So thank you so much for watching this video. I'll see you guys next time.